healthcare system right now is fairly fragmented with a lot of individual constituencies, whether that be physicians looking for their best working conditions or their best mechanisms for compensation, whether it be a community health agency looking for resources to serve its population, whether it be folks who look after mental health, whether it be folks who look after primary care. They're all disaggregated, and there's nobody sort of keeping a focus on that whole system. And indeed, it is that whole system that I think carries with it the pearls of an answer. If we had a more coordinated approach to healthcare that included our hospitals, but also included primary care and also included our community agencies, that was comprehensive in its outlook, not myopic. Our acute care hospitals really focus on the acute care issues, which is what they should. But they don't focus on chronic disease. We talk a lot about where healthcare is delivered, and the government, for example, in Ontario has come up with the mantra of the right care by the right people in the right place at the right cost. And I think, again, that those contain some important messages for us. Right now, the costs are largely driven not by the value that those services necessarily provide, but are historically based, as opposed to let's look more globally at what services should be provided to a population. The other element to that is we spend a huge percentage of our healthcare budget on the very sickest patients. We need to do a better job. We need to find ways of targeting that population, not having that then bounce back and forth from an emergency department every 2 or 3 days, have more care delivered in the home, have more access to information technology where a patient or their family can email the doctor, have an email clinic, for example. Those are the kinds of things that we're just starting to dabble in, but not doing comprehensively. We need to focus on quality healthcare in this country with a sharp eye on the value of the product that we're delivering. And we need to drive care into the environments where that care can be delivered A, most effectively, and B, at the best cost. That's a dramatic change if we can achieve that from what we're doing now, where our hospitals are crowded to the gills with patients, some of whom don't really need to be there and would be getting better care delivered elsewhere, with our emergency rooms having stretchers backed out the front door. We can't carry on like that. And again, coupled with the issue of our aging demographics and elderly population and management of chronic disease and people living into their 90s, we really need to find better ways to look after those patients. And that's why I say the main theme and the main deliverable, I think, from this conference is finding pathways towards integrating the various components of our healthcare, both in terms of their financial envelope of funding and in terms of the way they're governed and in terms of the way they're administered.